Okay, we're going to do now chapter 35D about what is cancer. It's from this book, The Medical Renaissance and the Vegan Reformation Bible by me. Okay, so we left off talking about the Warburg effect, how hypoxia damages mitochondria and cells can transform into running primarily on anaerobic glycolysis, and that's called the Warburg effect, and they become like cancer, just trying to proliferate and grow out of control. We talked about how that can happen in the liver with fibrosis leading to hepatocellular carcinoma, can happen in the esophagus, in the colon, in the pancreas, in multiple areas of the body. Otto Warburg, German biochemist, he won the Nobel Prize in 1931 for figuring out the Warburg effect. Now, if you look at the conventional medical textbooks, most of them won't even mention the Warburg effect, and then they're going to talk a lot about the SMT, somatic mutation theory of cancer. But I think the somatic mutation theory of cancer has been largely proven incorrect. There's certain situations where it's useful, but it's totally overrated. And the problem also with the somatic mutation theory is it leaves you, basically, you'll notice most of the things that conventional medicine promotes, they don't help the patient. They don't empower the patient. They just tell you, look, you got a genetic mutation, there's nothing you could do, just take our chemotherapy, take our surgery. Versus the metabolic theory of cancer gives you lots of things to do. And people who do those things, it's been shown that they have a chance to do much better. Okay, so the problem with the SMT is the data does not support it. They can sequence DNA pretty easily, and they did something called the Cancer Genome Atlas Project. And these letters, TCGA, are from the names of the DNA bases, the Cancer Genome Atlas Project. And basically, the SMT, the somatic mutation theory, it failed. They couldn't find a persistent, consistent mutation pattern to explain, like what they expected. The implication was that the mutations were happening after the cancer had occurred rather than being the cause of it. The metabolic theory of cancer explains the risk factors so much better. You know, it explains why Papua New Guinea and Japan, who smoked a ton of cigarettes more than the Americans, but the Americans had much less cancer. Why? Because they're also eating a high-fat, high-sodium diet, causing ischemia of their tissues, especially the high-fat, because the Japanese were also eating high-sodium. Okay, so the diet was as important or more important than the cigarettes for lung cancer. So people don't tend to be aware of that diet's a big factor in lung cancer. Papua New Guinea, they had 6 times less lung cancer than Americans did, despite smoking like chimneys. Okay, here's the great book by Dr. Caldwell Esselstyn called Prevent and Reverse Heart Disease. And, his big study was like July 2014, Journal of Family Practice. 197, 198 patients in a row. All the ones that followed the diet, they had 0 cardiovascular events in 4 years, whereas the ones who there was one patient who didn't follow the diet, had a cardiovascular event, which he could have even not included, but he wanted it to seem more legit rather than having 100% result. So it probably works close to 100% of the time. Esselstyn's diet is basically low-fat, 100% vegan. No meat, not one bite, no oil, not one drop, no dairy, not one drop, no sweets, no caffeine. He doesn't allow any nuts, no avocados, because those are high-fat foods. Nuts are like 70 to 90% fat. Okay, it's a good book. You can watch all this stuff for free. Just Esselstyn's got lots of lectures on the internet. Okay, he deserves a Nobel Prize, but he'll never get it because they don't want the proles to know about all this stuff. Okay, it's going to improve blood flow to the tissues. It's also going to lower the risk of cancer. Why? Because when you eat low-fat diets, you lower the risk. You improve tissue oxygenation, so you lower the risk of mitochondrial injury due to hypoxia, and thus the risk of Warburg effect, transformation of a cell into functioning like an anaerobic bacteria. Here's some quotes by Caldwell Esselstyn. Coronary artery disease is virtually non-existent in the Tarahumara, Papua New Guinea, Okinawa, Central Africa, and rural China. Nitric oxide is the most powerful vasodilator in the body. Nitric oxide is the life jacket of your arteries. As a matter of fact, I went to Caldwell Esselstyn's training course, okay? And he's sitting there going on and on. Nitric oxide this, nitric oxide that, nitric oxide this, nitric oxide that. And I was like, hey, what about this? What about this? What about this? And he goes, let me talk to you later. And so I talked to him later, and he's like, Pete, The patient has to understand nitric oxide. It's a big deal and what they can do to maintain nitric oxide levels. If they get that, they will be successful. If they don't get, they won't be successful. And all this other stuff doesn't really matter. And he's right, but for an intelligent person who's has some experience with the subject, it's nice to understand it in more detail. But he was right, and he's got the best results of anybody in the world. Okay, the number one goal of a good arterial function is to maintain adequate amounts of nitric oxide. As we get older, our arteries produce less nitric oxide. But the body has another way to produce nitric oxide, from plants. If you eat green vegetables at every meal, you keep your arteries bathed in nitric oxide. Okay, so that's what's about where you started hearing them the last couple of years, start telling people the really high-risk cardiac patients. Not everybody needs to do this, but if you've had a previous myocardial infarction, you're real high risk, you might want to do this. Okay, he has them chew on greens all day long, nibbling. All right, so what's that all about? By the way, sunshine activates nitric oxide too, because you got nitric oxide precursors beneath your skin that get released when you walk out in the sun. That's why walking out in the sun feels good. Okay, here's what he's talking about with the plants. Plants right here contain nitrate, that's NO3. It goes into your mouth. On the back of your tongue, there's bacteria that convert the NO3 to NO2. And then the NO2, nitrite, goes down into the stomach, and the stomach acid helps convert the NO2 to nitric oxide that then enters your arteries, and you get systemic vasodilation. Some common ways that people screw it up. You don't want to be using mouthwash or toothpaste with F- with fluoride, because that will kill the bacteria on your tongue, and then they won't be able to make this conversion step from NO3 to NO2. So you lose the benefit. So they can increase your likelihood of high blood pressure and of atherosclerosis and ischemia. Some antibiotics can do the same thing. You got to watch out for PPI, proton pump inhibitors in the stomach, because when they decrease the stomach acid, some antacids can do this as well. You'll have trouble going this last step from NO2 to NO, and you'll not get as good of a vasodilation effect. So that's the story of nitric oxide right there. Okay, let's see. Oh, I like this picture here. It's a picture of Dr. Esselstyn and his son, Rip Esselstyn. And the metaphor here is that he's like an Old Testament God, very unflinching. You must do this. No oil, not one drop. No meat, not one bite. No dairy, not one drop. Like an Old Testament God. Obey my commandments or I will kick your ass. Okay, so what I'm trying to say with that is, in my experience, most people, they're kind of wimpy. They're kind of passive. They do everything half-assed. They say, well, typical person, my family member and relatives too, not just patients. They go, well, I'm cutting down on meat. I'm cutting down on oil. And I'm like, the way it works is the older you get, the more fragile you get. And the more you have to optimize everything or you'll start going downhill. So, it's been said, like an alcoholic, you don't tell them you can drink on the weekend. You don't drink anymore. You don't tell a smoker you can smoke on the weekends. You don't smoke anymore. And the reason you say, why am I being so absolutist? Because that's what works. People who make the big change, they often get better and have dramatic recoveries and improvements. People who half-ass everything, what I've seen is they tend to get the dwindles. They make a little progress, then they go back down, make a little progress, go back down, and they end up in the long run usually not so great. Okay, so you want to be biblical about health. Thou shalt not eat meat. Thou shalt not eat oils. Okay, because that's what works. Let's see. They're all kind of the same thing, these diets. Dr. Kempner's rice diet, Dr. McDougall's starch-based diet, Chef AJ's whole food plant-based diet, especially with starches, no sofas, no sugar, oil, flour, or artificial sweeteners. Ruth Heidrich, PhD's diet, she's moved towards eating more raw foods because it was convenient. This lady here, this Dr. Day, she eats a vegan diet as well, emphasizes hydration as well. This lady, Dr. here, Janet Murray, she's the one from Australia. She's the one who ran a marathon every day for 365 days in a row to run all around the periphery of Australia. She had metastatic breast cancer, and she's alive over 20 years later. She had metastatic breast cancer, and she was alive like over 25 years later. She had metastatic breast cancer, and she was alive like 40 years later. She's still alive, okay? And I think she's still alive for two. I think she died recently. But she lived a long, long time with metastatic breast cancer. Decades. Probably think like around over 25 years, something like that. Okay, all of them are low fat, 100% vegan, no dairy, no oil. Kempner's diet of these was the most limited food choice. You know, the only rice was sort of like about the only starch. He also gave him fruits and even sugar. Sugar is not as bad as people say it is. I don't want to get into that whole discussion right now, but part of his goal was a lot of his patients had kidney failure, and so by giving them just plain old, table sugar, white sugar, which is sucrose, a combination of fructose and glucose, he was avoiding giving them any nitrogen, and he really wanted to reduce the protein load because there's only nitrogen in protein, and thus protect their kidneys. Okay. Ruth Hydridge, Janet Murray, Lorraine, they tend to eat a lot of fruits and thus a lot of raw, uncooked food. There's some people who think raw makes a big difference, that it's healthier, that all animals, eat raw food, and maybe our ancestors probably did too. McDougall actually says right from the start, humans were eating starch. So, I don't want to get into the details of that. I sort of think, why do we have color vision, whereas like your typical carnivore does not? It's so we can see when fruits are ripe. And by seeing the ripeness of the fruits, what we're also seeing is the characteristic colors of the fruits are like the antioxidants, the orange in a carrot, the orange in a sweet potato, a lot of beta carotene, the red in an apple, etc., etc., yellow in a banana. All right. Dr. McDougall believes that starch is the best food for all humans, and they should get the vast majority of their calories from starch. He recommends limiting fruits to only 1 or 2 servings per day, maybe 3 at the most. Okay, Chef AJ tends to see it the same way. There's a lot of really healthy, almost fruitarian types that I've seen. The one catch, though, is sometimes people can't get enough calories eating raw, so then they start eating high-fat raw foods, like a lot of nuts and seeds, and I don't like that idea of eating high-fat. I think there's a lot of problems with fat that are not widely recognized. Okay, my Rogers diet, which I often call the Spartan vegan diet, it's also been called the medical monk diet, is only organic food. I don't ever eat processed food. The only processed food I'll eat is single ingredient oatmeal, plain oatmeal with water, or plain quinoa with water, and I don't even eat them that much. I would never cook on aluminum or POFA cookware, those non-stick cookwares, or iron cookware, any of them. I won't eat any iron-enriched food because then you get iron overloaded in your blood over time. You get elevated serum ferritin. You get increased oxidative stress, which heads you down that pathway of Western disease. When I say Western disease, what am I talking about? I mean obesity, diabetes, hypertension, and those things causing hypoxia and causing cancer. That's a typical Western pattern of diseases. I probably eat about 60% starch, 35% fruits, 5% veggies in terms of the amount of calories for each of those foods overall. Okay. Now we're going to talk a little bit about the tumor microenvironment. Tumor microenvironment, a lot of times you can abbreviate it TME, tumor microenvironment, so TME. It's also called tumor milieu. A couple key points about it is the tumor milieu tends to be hypoxic, low in oxygen, and acidic, so high in hydrogen protons. And the relevance is that cancer is in a competition with the normal cells around it. Normally cells interact with each other a bit, and they sort of tell each other, do not grow, just do your job as part of a liver. You're a liver cell, an esophagus cell, a colon cell, a pancreas cell, wherever you are. Just do your job, mind your own beeswax, okay? Versus a cancer says, screw this, and it just grows out of control, tries to steal resources away from the other cells. And it'll pump protons into the surrounding tumor microenvironment, tumor milieu, and these, in a sense, sort of put the immune system to sleep. They suppress the immune system. You get more of these immune cells that are called Tregs, T regulator cells, that sort of turn off the immune system. And the cancer itself is a little bit complex. You'll have some cancer stem cells that are really only about 1% of the cells in a tumor. You'll have these dividing daughter cells. You'll have a lot of fibroblasts, stromal cells. And the modern research is improving with cancer. It used to be they do, two-dimensional monoculture of cancer cells. Now they're having more three-dimensional models of cancer cells. Okay, so these adjacent cells, the green ones here, they're sort of starving. Quite often the cancer is sucking up a lot of the nutrients and other valuable resources that come along. It'll suck up most of the local glucose and iron. It'll have a lot of receptors for these things to take it to itself, and then it'll pump out acid, which is harmful to the surrounding cells and suppressing the immune cells. Okay, immune cells are put to sleep by the peritumoral acidity. the acidity of the tumor microenvironment. That's also why you want to avoid things that are acidic. Animal protein is more acidic. It's got more sulfur-containing amino acids that are in part converted to sulfuric acid as part of their metabolic degradation. You're also going to have more sodium, and the chloride is going to displace bicarbonate ions, and that's going to cause a low-grade metabolic acidosis that contributes to this tumor acidity. You know, protein is made out of amino acids. Acids, that's more acidic, okay? And fat also is made out of fatty acids. Acids are more acidic, whereas carbohydrates not. Carbohydrates do not have any iron. So one of the points I wanted to make is you got 1% of these cells are cancer stem cells. These cancer stem cells in particular tend to be quite often very resistant to chemotherapy. So that's why you can give chemotherapy and shrink the whole tumor quite a bit. But if those cancer stem cells are still alive, quite often the tumor just comes back, you know, rip-roaring, growing faster than ever before. So, you know, one has to be careful when they give chemo. If it's indicated, fine, but a lot of times it's not. Cancer stem cells can be replicating slowly, and they might have more plasma membrane transporters that can pump the drug out. Fruits and vegetables are relatively alkaline, and that creates a more alkaline tumor milieu, which helps favor the normal cells and give them some advantage over the cancer cells, because you want the normal cells to just be controlling things, not the cancer cells. We talked about meat and sodium chloride, sodium, salt, being acidic, favoring the cancer. Let's see. Bicarbonate's the pH buffer in the blood, so again, that's displaced by the chloride in the when you eat a lot of salt. Okay. Okay, the next image here is talking a little bit about the effect of sodium. Well, no, the effect of psychological stress. Psychological stress causes some platelet activation, which is bad because activated platelets can surround a cancer cell that has entered into the blood and is, you know, trying to metastasize. And they can hide the cancer cell from the NK cell, which is another name for cytotoxic T cell. So these are cells that will remove cancer cells, but they're prevented when they can't recognize the cancer cell because, you know, the way the immune system works is it like reads other cells by braille. It feels the antigens, the molecules on their surface, and it's either self, okay, leave this one alone, or non-self, then they have to try to remove it. And cancer cells will have non-self type proteins on their external surface, and the cytotoxic T cells can read that and then remove the cancer cell. But if it's hidden because there's platelets stuck all around the outside of it, the metastasizing cancer cell can have a better chance of spreading. So excessive psychological stress, which also goes, caffeine elevates the same hormones, sleep deprivation, they all increase the risk that a cancer cell can metastasize. Dietary sodium can also activate platelets and help to hide metastasizing cancer cells. So these are all, understanding these things tells you exactly what to do. Avoid acidic foods. So avoid excessive fat, avoid excessive meat, avoid all meat, and avoid excess sodium, okay? Avoid excess psychological stress, have religion, have a sense of purpose, all the things that improve immune system function, okay? And high-fat diets damage immune function. High-fat diets will inhibit the cytotoxic T cells, also called NK cells. There's a good lecture if you want to watch it. You can check out this lady. Her name is Lydia Lynch. She's a PhD. She's from Ireland, but she's on staff now at Harvard at Brigham Women's Hospital. She has a very good lecture called Obesity and the Immune System. And it's at Global Immunotalks, is their YouTube channel. And she'll talk about how high-fat meals damage immune system function. And also, just being fat. When you're fat, you release more free fatty acids into the blood, and those will also have a detrimental effect on immune system function. Dr. Neil Bernard had a good quote. He said that the immune cells can't function well in an oil slick. And he's using that to refer to high-fat diets increasing blood lipids and causing a decrease in immune cell function. In a later lecture, I'll go into more details of the mechanism, but that's enough to know for now. Okay. Yeah, so basically all cells have like their own identification card, ID card, and when they go past immune system cells like dendritic cells, which are really like residential macrophages, those are also called sentinel cells, they read like braille. They check the molecule, its surface proteins, and say, is this self or non-self? Okay. We're going to talk more about the glycocalyx. We already talked a little bit about it in the context of atherosclerosis. So glyco means sugar, calyx means coating, proteo means protein. So it's really, you could call it the glycoproteocalyx. And it's just every outer surface of a cell, just kind of like trees grow on a hill. There's all these proteins that stick out, and they have characteristic patterns. And the sialic acids at the end of the glycosaminoglycans as part of the glycocalyx, they're often especially important for immune system identification of self versus non-self. Okay, and then I talked about how corticosteroid medications, sleep deprivation causing increase in cortisol, stress causing increase in cortisol, caffeine causing increase in cortisol, all weaken the immune system and make it less able to remove cancer cells. Okay, catecholamines are adrenaline and noradrenaline, same thing as epinephrine and norepinephrine. Catecholamines also are of concern because they can potentially function as siderophore. Sidero means iron, phore means to transfer. And the relevance is, just like bacteria can't grow without iron, cancer cells can't grow either without iron. So you want to sequester iron and keep it away from them. When there's excess amounts of free iron, you get elevated serum ferritin, and you get elevated free iron that's potentially available to do tissue damage through oxidative stress or to simply be given to the cancer cells, and they use it for making cancer-dependent enzymes, and that helps them to replicate, to grow. So you want to deprive cancer. Remember the Fabian strategy used against Hannibal when he was fighting the Romans. You want to deprive them of all the things they need to help prevent them from growing. High saturated fat can also cause activation of platelets. So look how stupid the standard American diet is. It's high in fat, which can cause activation of platelets. It's high in sodium, which can cause activation of platelets. It's often ingested with caffeine, which can cause activation of platelets. The person is often stressed out and sleep deprived. All of these things are activating platelets, making them stickier to hide the metastasizing cancer cells. So that's why you want to avoid those things. And that's why this knowledge is useful, because it helps you to avoid the things that increase your cancer risk. Okay, so I think we'll call it a day for now. We'll start with this diagram, the next one. And so we learned some valuable stuff. The metabolic theory of cancer shows you how metabolites, foods, increase cancer risks, certain ones that are bad. So once you know them, you can avoid them.